Nearly a quarter of American adults committed to staying sober in the first month of the year in 2024. Now there may be more reason for people to join in on that trend in 2025. Surgeon General Dr. Vivek Murthy issued an advisory today linking alcohol consumption to cancer. That applies to any type of alcohol, linked to 7 different types of cancer. Murthy says alcoholic drinks should have the same kind of warning labels that cigarettes do. Right now, alcohol bottles and cans, you've seen this, they have warnings about drinking during pregnancy or drinking and driving and operating heavy machinery, of course, along with general health risks. It's not clear if or when the recommendations would be adopted. Congress would have to pass legislation in order to have added warning labels about cancer. The report comes just before the U.S. dietary guidelines are set to be updated, and just a few weeks before President-elect Trump returns to the White House, along with his health secretary nominee, RFK Jr., who's vowing to make America healthy again. We should mention, neither of these men drink. Joining us now, Dr. Marion Nestle, professor of nutrition, food studies, and public health at New York University. She also served on the U.S. Dietary Guidelines Advisory Committee. Doctor, welcome to the show.
I'm glad to be here.
So first, your reaction to the Surgeon General's new advisory.
Well, I thought there were 2 really interesting things about it. One was that his statement was absolutely unambiguous. Alcohol causes cancer, 7 different types. No mays, no mites, no, the evidence suggests nothing like that. Alcohol causes cancer, period, full stop. The other really interesting thing about it was that it comes a week after the National Academies of Sciences came out with a report that said, well, we can't find anything except really low quality evidence that links alcohol to cancer. So we're in a situation now where 2 major authorities have come out with very different advice. And a 3rd report is still expected very soon.
Doc, just for our viewers, I want to remind them about the last time American dietary guidelines were updated. It was back in 2020. This is what they said: moderate consumption of up to 2 drinks for men and 1 for women every day is fine, even stating alcohol is a carcinogen. Now, scientific advisors propose the idea of more strict guidelines for women, capping it at 1 drink per day. You've served on the advisory committee. You've even posed the question, could warning labels be next? You were looking ahead this whole time. When we're looking at these dietary guidelines from 4 years ago and now the complete turnaround, what do you think?
Well, it's not a complete turnaround. The dietary guidelines have said since 1990, I believe, that 2 drinks a day for men and 1 drink a day for women was probably not going to increase risk enough to worry about. And that's really not terrible advice if people follow it. And if the drinks are small, and everybody lies about how much they drink, it's a problem. But the Dietary Guidelines Advisory Committee, not this one, the previous one, said that it shouldn't be 2 drinks a day for men. It should only be 1 drink a day for men because of the increasing evidence that even small amounts of alcohol increase the risk for cancer and other kinds of diseases. The argument has always been that small amounts of alcohol reduce the risk for heart disease. There are big debates about that, but the National Academies Committee said that there's moderate evidence that alcohol reduces the risk of heart disease, but there was also moderate evidence that it increased the risk for breast cancer, although not the other kinds of cancers that the Surgeon General listed. So this has to do with which studies they're looking at, which ones are excluded, and how the various committees are interpreting the evidence. Like all nutrition research, this is complicated.
But it is complicated, doctor, especially for people like me, and I'm assuming most of our viewers who aren't as well versed in this area. We're hearing different things. Wine is fine. Stay away from the brown stuff. And you mentioned that there is increasing evidence of these correlating links. Then why is it taking so long to update the labels?
Well, labels always take a long time to update.
I mean, decades?
Decades
Yeah.
would not be unusual. The FDA moves at what used to be glacial speed before global warming. These are very hard to do, and they require a lot of public input. And the minute you get into public input, you get the alcohol industry involved, and the restaurant industry, and the hospitality industry, and everybody else who profits from the selling of alcohol.
Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.